So I think the thing that we do in pediatrics that is undervalued by the rest of the world is play. And so a lot of kids, the way they interact with the world, the way they learn through the world is by playing. And when you take a kid and they're frightened and they're scared and you just do funny things like blow up a glove and, play balloon glove with them in the room, they start to relax. And that's also one of the nice things about oncology is we do build these long-term relationships with kids and their families. It's a very great question to wonder, what an academic medical center gives to somebody. We're bringing, new therapies and new techniques and, changing outcomes for patients by pushing the field along. There was, if you just look at just an example in pediatrics. So, pediatric medulloblastoma. It's the most common of the malignant brain tumors in pediatrics, okay? And then 15 years ago, 20 years ago, your survival rates were below 60%, okay? And through dedicated research, in part due to physicians here, others across the country, that has steadily moved up and up and up, and now we're in 85+% survival rate. And so that is the kind of thing that happens in an academic medical center that you're not getting at a private practice institution. My particular research focus is in the brain tumor formation in pediatric patients. So what are the factors that contribute to that formation? And that's actually one of the most common questions we get when we go into an initial conversation with parents is, why did this happen to my child? There's a tremendous amount of guilt that a lot of parents feel. It's not justified. They did not do anything wrong. But a lot of parents do feel that way, like that they're responsible somehow for their child getting cancer. And so one of the things, as a researcher that I can bring to that and that my area is looking at this, factors that influence tumor formation in pediatric patients is being able to say, no, this isn't something you did wrong. These are the factors that have contributed to your child's brain tumor. My initial motivation for going into oncology is, I think, really driven by family. And that is because my own family was very strongly affected by cancer. My brother had cancer when I was a child, and I think that's one of my first memories of really as a young child of my brother being diagnosed with cancer and how terrified my parents were. I still remember how that felt, that terror that people feel. And then, not only did my brother have cancer, my first cousin had cancer. She also had a pediatric tumor. She was at this point, kind of in our adolescent to young adult range. She did not have such a pleasant outcome. And then I've had both grandfathers, my father, my mother have all had cancer. And so it's a very motivating thing to see this just tear through your family and to know that, in some circumstances, I'm thankful there was a very great outcome. And in other circumstances, there was not. And that's very motivating, I think, both to care directly for patients and then also to be involved on the research side of things, to drive it forward, to make sure that those next people that come in that have those diagnoses that are so awful and there's nothing they can do about them, to make sure that next time there's something that we can do about it. I think knowing that your physician is one of the people who is not only going to make sure your child has the best outcome, but is also going to be looking to push the field forward to make sure that every other child that comes in after your child gets better and better and better care is extremely important to a lot of families. Maybe not at that first conversation, at initial diagnosis, when they're so overwhelmed, but I think for a lot of families over time, that becomes really important to know that their doctors are contributing to the field moving forward.